At the Chronic Disease Coalition, we work to advocate on behalf of patients, but also to help them advocate for themselves. We really wanted to put even more data behind our healthcare policy work. So what we did is we commissioned a study of more than 1,000 people with chronic diseases from across the country. We want everybody to see what patients are talking about and going through in their day-to-day lives.
Chronic disease patients are found in every demographic group. You can see gender evenly divided. Nearly two-thirds of these respondents feel that the mental health challenges managing a chronic disease are not talked about enough. 6 in 10 say they often feel stressed dealing with their condition.
Being misdiagnosed and dismissed, and how that then leads to your feelings of, poor mental health and stress. So it's a lot of trickle-down effect.
1 in 5 say their health insurance does not fully cover the cost of their medication. 1 in 4 indicate they have difficulties managing the cost of their treatment. And 3 in 10 indicate that they sometimes have to decide between treatment and basic necessities.
Yeah, how insurance works, what insurance will cover. I've personally found new treatment options are really tough.
It is a lot. Like Dustin said, prior authorizations, fighting with insurance companies, that can be frustrating, and that can also cause more pain and prolonged treatment.
That represents 30 million Americans who say they feel discriminated against at work because of their condition.
Chronic diseases make it harder to work, to care for family, and to be in community.
And half often experience feelings of isolation and depression.
We have to do a better job of talking about these problems in a way that makes patients feel like their perspectives are needed. They're not just wanted, but they're needed in the policy space.
The experience of being sick is incredibly isolating.
Even though it can be an isolating experience, we can now point to this survey and say, I'm not alone, right? I had to choose between rent and treatment last month, as did 29% of chronic disease patients in this country.
It's so important to have that support, not to feel alone, and to help us all get the help we need.
I always say that we go through things not for just ourselves, but so that we can help other people.